Hey everyone, some of you know that I suffered a fairly serious health condition recently, and instead of being a provider or a qualified health professional or a physician, I became a patient myself. I was put through the medical industrial complex and suffered through like a lot of your patients did. And I went through the coding and billing conundrums that you all went through. I want to share something with you that I experienced recently. So I had a serious illness back in November of last year, and in February, I needed a sleep study. I went through the sleep study. It was at a facility, went through it. The facility billed my insurance. Apparently, it was all paid. Everything was good. I settled my deductible and co-insurance and stuff like that. They collected that at the time of the study. There was another charge that came through shortly after that, also in February. It was a bill that I received from the ENT doctor, pulmonologist, whoever it is, someone I never met, who interpreted the sleep study. I received a statement for about $31. I guess that's my deductible or copay or co-insurance, whatever it may be. It came in form of a hand-addressed letter, not in the state where he is practicing, but it came from what I found out later was a third-party billing company. It was for about $31. I thought, well, this does not look too legit. What made me even more suspicious was the statement was printed on a dot matrix printer. Now, some of you may be too young to know what a dot matrix printer is. In essence, letters are made by inking little parts on a small rectangle, and those, depending on where you inked the little dots, and depending on how many dots are on the print head, it created a letter, number, or symbol. So that statement was printed on a dot matrix printer. You may be able to see those printers at airport terminals where you check in before you board. Believe it or not, they still use dot matrix printers. Print quality was suspect. Not only that, in a handwritten note on the statement, on this suspicious looking statement, it said, "Call this number, pay with credit card." I thought it was a scam. But that aside, I, like many patients, ignored this statement. I deliberately ignored the statement. I wanted to see what would be the action of this billing and coding company, supposedly. What will be their action? What will they do if I ignore that statement? And it is now, this recording is on August 17th of 2022. The statement came out in February of 2022, a full 6 months since the services were rendered. I did not pay my balance. And how many times was I contacted by this billing company? A big fat 0. Never called, never texted, never sent another statement asking for that balance. So I'm thinking, oh my gosh, this poor physician who provided the service stuck his neck out, took the liability of interpreting this result, this report, this study, and yet he's only paid a part of what is due him. And this is something that plays out all over the United States every single day. The typical problem is that these third-party billing companies and coding companies, how do they get paid? They get paid by a percentage of what is collected by the physician, by the healthcare entity. What is the easiest way for them to generate revenue? Is by submitting that claim and collecting whatever is automatically paid and adjudicated by the insurance company. to chase after the $31, it would require them more work. So if you're thinking about opportunity cost, I can spend a minute to collect more money using the insurance by submitting the claims to the insurance versus calling the patient, sending the patient a letter, emailing the patient. A lot more work, less pay. So of course, they go after the low-hanging fruit. That's why after 6 months, I did not receive a statement, did not receive another call to ask for the amount that I'm supposed to pay to the physician. This is something that happens every single day. Even if you have an in-house billing person or staff, you need to be mindful that your staff is not simply writing off those balances. Those are patient responsibilities. Those are my responsibilities as a patient, my contract with the insurance company that I need to pay. And by you not collecting what is patient responsibility, you would be in breach of that contract. And what may happen if this is discovered by the payer, insurance company, is that, well, it seems like, Dr. Lin, you're not collecting the 20% that is you're supposed to collect. Well, it looks like you are automatically adjusting your fee schedule down by 20%. So your new full payment will be 80% of your current payment. That will be your new payment because you agree to collect the 20%, but you're not doing it. So that will be your new fee schedule. It can happen. It has happened. So the moral of the story is you have to figure out what the patient responsibility is. And I would highly encourage you to collect this upfront at the time of the service, because the value of your services goes down very, very quickly to almost nothing after the service has been rendered. That's number one. Number two, it is your legal contractual responsibility to collect the copay, coinsurance, unmet deductible from your patients. I expected to pay for that, but no one chased after me. And this is kind of an experiment that I wanted to do as a patient myself to see what would happen if I didn't pay. Because this statement, number one, looks suspect. And number two, this looked like a rinky-dink billing company that doesn't have their stuff together. And when you don't have your together, when you don't have that together, your patients are likely to take advantage of you. And who ultimately suffers? The physician, who has to take on the liability, the work, the payroll, and the overhead to cover his or her expenses while they're not made whole by the staff not going after the patient responsibility or balance. Anyway, let me know if you have any techniques or if you have success stories on how you have been collecting unmet deductible, copay, coinsurance, and share with us how you're doing it. I will tell you, it's been over 10 years now that we have collected copay, coinsurance, unmet deductible at the time of service. And in my little practice, this is over 10 years now, almost every single year, patient responsibility, meaning what the patient pays us, has been the number one payer, if you will, for the practice for over a decade. If you are not collecting the copay, coinsurance, unmet deductible, just imagine how much you're leaving on the table. Anyway, as usual, comments, questions, leave them below. And if you want to learn 30 ways to improve your margin in your medical practice, please click on this card to your left. Take care. Bye-bye.